Hello and welcome back to GP Video Podcast by Nadia. So today the topic that I'm going to talk about is something or a problem that I think we all have encountered at some stage in our lives. But it does become a problem if it doesn't go away in a few days and happens regularly. So what am I talking about? I'm talking about swollen ankles, feet and legs or edema. So I'm sure we all have had this swollen legs, feet or ankles at some stage in our life, but it just goes away with the resting and then doesn't happen regularly. But if it happens regularly and doesn't go away in a few days, even after resting and doing all the precautionary steps, three organs we always have to think about. What are those three organs whose failure or whose insufficiency can cause edema in the body or fluid collection in the body? These three important organs are kidneys, liver, and heart. When somebody has fluid overload in the body or excess collection of fluid in the body or edema or swelling of any part of the body which is not going away even after resting and everything, then these three organs should be checked immediately by consulting your GP. So now let's just read about it. Swelling in the ankles, feet or legs often goes away on its own. See a GP if it does not get better in a few days. Edema is swelling caused by too much fluid trapped in the body tissues. Edema can affect any part of the body, but it's more likely to show up in the legs and feet. So what are the common causes of swollen ankles, feet and legs? Swelling in the ankles, feet and legs is often caused by a buildup of fluid in these areas called edema. Edema is usually caused by standing or sitting in the same position for too long, eating too much salty food, being overweight, being pregnant, taking certain medications such as some blood pressure medications like amlodipine, contraceptive pills, hormone therapy, some antidepressants or steroids. Edema can also be caused by an injury such as a strain or sprain, an insect bite or sting. But the most important thing that we really need to work upon if it persists for a few days and also doesn't go away after resting up, also doesn't go away like after resting up and after taking care of it, and then happens, even if it goes away, it comes back, happens regularly and lasts for a few days. Kidneys, liver and heart. Always think about these three organs, and also your GP would always think about these three organs, eliminating any problems with these three organs, and then look into the other causes. So what are the other causes? Number one is idiopathic. Like there is no cause, but either you've been standing for too long or sitting for too long, or the other cause could be eating too much salty food. But I generally think that eating too much salty food and causing edema is also related to some issue with the heart or kidneys because kidneys remove this excessive salt from the body. So if kidneys are not working well, then it means that excess salt is causing excess fluid retention. So there are two causes of fluid retention. Either there's too much there's too much fluid coming in either intravenously or orally, or the other cause is that the body is not able to get rid of this excess water. So which is, in that case, kidneys are the most important, because kidneys are the organs that get rid of excess water and excess salt. So if kidneys are not working well, then again there could be excess fluid collection. But I'm not saying that the general, like sometimes happening edema of swollen feet, ankles are all because of the failure of your liver, kidneys or heart. But if it happens regularly and doesn't go away for days, then please consult your GP for them to be able to make sure. See, your kidneys and liver can only be tested with a simple blood test. So liver function test and renal function test or kidney function test, if they are normal, then generally 99.9% it means that your liver and kidneys are fine. With the heart, again, then there are simple tests like your BP can be recorded, an ECG can be done. There are some cardiac markers if needed, they can be done. A proper thorough history and examination can be done. If needed, an ultrasound of the heart can be done, which is called echocardiogram. So these are all very simple tests that can be done to make sure that your heart is working fine. your kidneys are working fine and your liver is working fine. But apart from these, what are the other causes? As I said, standing for too long or sitting for too long. Pregnancy and premenstrual syndrome, because of the hormones, they can also cause fluid retention. And apart from that, eating too much salty food, but again, I don't agree with this one. Till your kidneys are working fine, I don't think that should be a problem. And taking certain medications. Again, medications are very important, such as there is a blood pressure medication called amlodipine, which is a calcium channel blocker that can cause peripheral edema, contraceptive pills, and antidepressants or steroids. I'll talk to you next time.